Podiatry is a medical specialty that diagnoses and treats conditions of the foot, ankle, and related structures of the leg. We talk with physicians from Podiatry Associates of Houston about their practice and began by asking Dr. David Bloomfield about the evolution of their specialty.
I think in the past, most people would think that podiatrists were maybe just doing corns and calluses and ingrown toenails. Now we still do those things, but the advances in medicine and our training have allowed us to handle bunion deformities, ankle deformities, heel pain, and other things that in the past maybe they weren't being treated for. So today's podiatrist is very well trained, well educated, and is a very big part of the medical community.
We asked Dr. Bloomfield, is there such a thing as a typical patient?
You know, when people ask me why did I get into podiatry, and one of the things that's great about it is we treat everybody. We have babies come into the office with foot problems, and we have the older generation, obviously, you know, coming in with foot problems, and people all in between. I think that the majority of our patients tend to be women. One of the biggest problems they have are bunion deformities. And their biggest question is, well, I must be wearing too small shoes. And that's not necessarily true. Most bunion deformities are genetic in nature. Whether they hurt or they don't hurt depends upon your occupation, what kind of shoes you're wearing, and whether you treat them or not. Athletics, we see a lot of runners, people coming in with plantar fasciitis because they've been running too long, or shin splints, so we see a lot of those kind of problems. And just basically we'll see a lot of kids. Kids come in with flat feet. A lot of the pediatricians will tell the parents, oh, your child will outgrow those problems. But the thing with the pediatrician is they don't see the patient 20 years down the line where they may have a significant painful flat foot and they weren't treated. So we can get a child when they're 6, 7, or 8 and we start treating them, we can eliminate a lot of their pain as they get older.
Dr. Michael Mineo told us about the prevalence of heel pain.
Heel pain is probably one of the most common things we see nowadays in our office. Patients come in complaining of extreme, moderate to extreme pain, usually walking, standing, and sometimes it's much worse in the mornings when they first get up out of bed or getting up from a resting position. Most of the time it's relieved a little bit from walking during the course of the day, but then comes back in the evening after they're sitting and relaxing a little bit. But it's a treatment, it's a condition that's been around for years and years. Most of the patients we see today are treated first with as conservative as possible. We try to render them pain-free with medications, sometimes with orthotics, with paddings on their foot. If that does not work, then we have the options of either surgery or the shockwave therapy. Shockwave therapy is the procedures that we try to get the patients to go ahead and do rather than the surgical, because it is an ambulatory type of procedure and it's non-disabling. They can have it done in an office and walk out of the office. And usually 2 or 3 treatments renders them rather pain-free, and it's long-lasting.
Another serious problem of the foot is neuropathy. While we were at Podiatry of Houston, we talked with Dr. Vito Speciale about the dangers.
Typically with neuropathy is once it begins, there's usually a progression of the pain. And a lot of times it will start out very, very painful and then develop into a strict numbness. And some patients are grateful for that because how excruciating it can be. The issue associated with that is obviously if you can't feel your feet, you don't know that you're stepping on a tack. You don't know if you're developing an infection until it's potentially too far. So finding the cause of the neuropathy is usually your best option, at least initially, and trying to stop that progression if you can. There's medical options and there's surgical options. Some of the neuropathic patients, there's topical rubs, so to speak, that will sometimes alleviate some of those symptoms and make things more comfortable. Sometimes there's medications. There's a couple different 3 or 4 medications out there that are very commonly used with diabetic neuropathy. But there's also potentially a surgical option as well, especially if it involves more of a tightening around the nerve. and sometimes we'll do surgical releases to alleviate some of that pressure on the nerve. And there's several studies that are out nowadays and advocating surgical release of large nerves to allow that circulation to increase within the nerve and decrease the amount of neuropathic pain that some of these patients are feeling.